Hello, my name is Tyler Anderson, and today I'm going to be talking about in adolescents with femur shaft fractures what surgical option allows for the quickest recovery, less complication, and less risk of infection. Before I begin, you'll see these two pictures on the screen. These are actually photos of me as I suffered a femur fracture as an adolescent. I was in the 8th grade when this occurred, and I broke my femur racing motocross. So to begin with a definition, the femur is your thigh bone between your hip and your knee. This is the most common major musculoskeletal injury in adolescents. So when looking into epidemiology, which I'll be discussing now, 11% occur in children who are younger than 2 years of age. 21% of these are seen in the ages of 2 to 5, 33% are seen between the ages of 6 and 12, and 35% are seen in adolescents between 13 and 18 years. So this category involves me. I was 15 at the time when I broke my femur. It is also stated that 71% of pediatric femur fractures occur in male patients. So getting into a little bit of background information, when looking into like the surgical options as of femur fractures, body weight and the size of immature adolescents as they go into the phase of becoming an adult play a role in what option is better for them due to the weight and the size of the individual. Now also location and the fracture type also play a role in determining what option is the best. So some of the benefits of the surgical management option is that it adds in rapid mobilization, it minimizes physiological impact, and prolonged immobilization. Also, it's a shorter hospital stay, and the patients are able to return home into school quicker than those who prefer to do a non-surgical option. Now, when looking into these surgical options, I chose the intramedullary implant, which is commonly seen in adults, but it's a better choice for the adolescent patients who are more in bigger size. So for some of the patients who are a little bit younger, there's a TENS option, which is a elastic nailing. This is preferred management for more of younger patients, but it's starting to become more commonly seen. But now most patients are being introduced into the intramedullary implant. So sometimes, like the mechanism of injury that occurs, most of the time in adolescence, it's either to a fall or motor vehicle collision, which is the greatest cause for adolescents. Some of them do happen due to um, sporting events. But it also said in the research that over 15% of the femoral fractures in patients that are younger than 2 years old are due to child abuse. So now I'll be discussing some treatment options. So as you can see these pictures, we have 4 options that I looked into: the elastic nailing, external fixation, intramedullary nail, and a plate fixation. The idea treatment method should provide, it's supposed to provide stability and permanent mobilization. And these options are to minimize scarring, avoid serious complication, and also achieve the goal of cost effective. So for the elastic nailing, this is, like I said, being the most commonly seen in the patient, and involves 2 elastic pins that come in and curve to stabilize the femur. The external fixation, which is shown to have the most complications, as you can see in the second to right picture, is where they put 2 nails to place in the femur, and then you have an external rod which they will adjust to bring the femur back together. This is the one that causes which is seen to have the most infection rate and rejection rate, and also has the most complication, as I stated. Now the intramedullary nails, this is starting to become more commonly seen in adolescent patients. This is normally seen in adults. This is one I also do have. There is not much of a complication rate for this. There once was said to be it would be rejected and have to be taken out. Personally, on my hand, I have not had much pain with this other than the nails where they go in, the two pins. Sometimes these do need to be removed, but it's not very likely. Now, with the plate fixation, this isn't really commonly used anymore. There wasn't a lot of research found on it. It is a good surgical option, but it depends on where the location of the fracture actually is. Now, when looking into some of the complications, the most common complications are loss of reduction, infection, and also sometimes in need of to be reoperated. So sometimes these surgical options do tend to be rejected. Um, so, like I said, there's also common concern about the body weight and size. Um, and depending on the size, the elastic nailing do not provide the most stability. Um, and also going into the healing mechanism of it, most femur fractures in adolescents are seen to be healed within 8 to 10 weeks of the surgery. So now going into the intramedullary nailing, which I am looking into, this is the surgical option I had. Now there are a lot of benefits to it. It provides good mobilization. You can be weight bearing. There's a decrease in your hospital time. There's not really any hip or knee complications, and the overall successful rate is very high. It also is a very effective and safe treatment option. It is a very quick recovery, and there are several different types of nails that can be used. One of them is the 15 Zimmer titanium nail, the 30 Russell Taylor stainless steel, and 3 Sensus stainless steel nails. I have a titanium rod, which thankfully has not been rejected. So overall, the best surgical option for this is going to be the intramedullary nail. This is depending on the patient's weight and size. Um, like I said, most depends and varies on the adolescent. So between all the options, the elastic nails are good for smaller adolescents, and the intramedullary nail is good for bigger adolescents.